ladies and gentlemen. I'm your host, Dr. Samit Buddhika. So let me welcome you all to another successful event organized by Peradeniya Engineering Faculty Alumni Association. Today's talk is a very timely, important talk, and it is the story of about you and me. So this today the session is no need too much introduction. It's you touch your heart and you feel it is about planning your future with COVID. So I hope today we have very eminent guest with us, Dr. Ananda Wijewickrama. So I will warmly welcome you to the event. This need no introduction. I think the time in some form of in your life during these last 2 years, we are battling against this war, and I hope you had some form of experience, either some of your relative, some of your close friend has struggled, has some encountered some problems with this, and also some people have lost their businesses, but some people have got some opportunities with this, and have capitalized. So there are many ways to explain this, but I prefer the explanation given by this the president of Vietnam. It's like the COVID is like I'm sorry, it's like your wife. First you try to control it, but then you try to learn to live with it. So this is a kind of a scenario that we are living in, and today the speaker, we don't need introductions. Actually, he's a very famous person who is working very hard to battle against this war. At some point of time, I heard somebody saying he's the General Sarat Fonseca against the COVID-19 war, right? So sir, I warmly welcome you. To formally welcome all the participants and the chief guests to the event, I first cordially invite Dr. Prabha Veerapon, the treasurer of PEFAA. Madam.
Yes.
Your wife. First you
Thank you, Dr. Samit. And good afternoon to all of you in Sri Lanka. And good evening, good morning to those who join from other parts of the world. It's my pleasure to welcome you all to the talk organized by Peradeniya Engineering Faculty Alumni Association, or PEFAA, on planning the future with COVID-19, a timely, very important topic in the world today. First and foremost, I warmly welcome our speaker today, Dr. Ananda Wijewickrama, the Senior Consultant Physician of National Institute of Infectious Diseases, or IDH. We, PEFAA, greatly appreciate your kindness to accept our invitation at this very busy and strenuous time, delivering your valuable services to the nation. We are very excited to listen to today. In fact, we are very much privileged to listen to one of the top experts in the subject and COVID-19 patient care. Despite the lockdown and pandemic, we have a considerable participation of members and friends in every corner around the globe through online mode. I warmly welcome all of you to today's talk. For the information of new participants who are not familiar with PEFAA, I like also to mention that Peradeniya Engineering Faculty Alumni Association was established in September 1991, exactly 30 years ago, and it is the first alumni association established at a faculty in Sri Lanka. PEFAA supports the development of the faculty, welfare of the students and alumni, and the society in many ways. This talk series is one of its most attractive activities. We are happy that the PEFAA Talk series is conducted very successfully through Zoom and YouTube. Without taking any more time, I warmly welcome all of you again to the talk and I expect your active participation in the discussion followed. Thank you. Over to you.
Thank you, madam. Thank you very much, madam. I warmly welcome now to introduce the speaker. I warmly I invite kindly Dr. Shobha Herath, the secretary of the PEFAA.
He is the only brother of my closest school friend. I am proud to know this humble public servant who not only serves the country as a specialist doctor, but also spending a lot of his valuable time to educate the public through live discussions in media. Don Deshapriya Ananda Wijewickrama is born in Goa. He had his primary education at Kalahi Sri Sumangalodaya Mahavidyalaya and second education at Mahinda College, Goa. He then entered the Faculty of Medicine, University of Colombo, and obtained his MBBS degree. He obtained his MD from PGIM, the Postgraduate Institute of Medicine, Colombo, MRCP UK from Royal College of Physicians, London, and became a Fellow of Ceylon College of Physicians, HCCP. He was the President of Ceylon College of Physicians in 2020. His specialty is in infectious diseases, including dengue, SARS, avian flu, and HIV. His research interest includes clinical management of COVID-19, dengue, HIV, and chickenpox. He is a pioneer in improving clinical management of dengue in Sri Lanka, educating the public as well as the medical community. He served in numerous committees and editorial boards in preparing guidelines in this regard. He has published a number of publications in peer-reviewed journals and delivered many guest lectures both in local and foreign medium forums on dengue, COVID, etc. He is currently the senior consultant physician at National Institute for Infectious Diseases, popularly known as IDH. He is at IDH since 2003. Dr. Wijewickrama is also working as an external lecturer examiner in faculties of medicine of Colombo, Sri Jayawardenepura, and Kotalawala Defence Academy. He also serves as a member of the National Medicines Regulatory Authority of Sri Lanka. With the current pandemic, as you all know, he and the team at IDH are working tirelessly for more than 18 months without a break. You all may have seen Dr. Wijewickrama participating in many discussions on TV, such as ITN Doramadalawa, Derana 360, etc. After 18 months of restricted movements and activities, we at the university now plan to continue our normal activities under new conditions. For that, we must learn to live with COVID-19. So we have the right person with us today to advise us on our future planning. Without taking much time, I would now like to invite Dr. Wijewickrama to deliver his talk on the topic Planning the Future with COVID-19. Over to you, Doctor.
Thank you very much, Shobha, for those kind words. I consider this as a great honor and a privilege. And when Shobha asked me whether I can give a talk on this, I could not refuse for many reasons. Firstly, as she mentioned, I knew her from my childhood, though we haven't met for the maybe last 40 years or so. Then there were more reasons. My sister works in Faculty of Medicine, Karapitiya, and her department of head is Shobha's brother. And but more than that, during this pandemic, over the last 18 to 20 months, our hospital had a lot of support from engineers, to improve our facilities for patient care. I cannot say no to a request made by an engineer. But more importantly, I believe, in my opinion, the future lies in the hands of engineers with this COVID pandemic. I will explain why I say so as my talk progresses. If I may share my slides. So I want to everyone. So the topic I'm supposed to talk is planning the future with COVID-19. About in last August, I came across this article which was regarding the pandemic's future. The author starts it by saying researchers are developing a host of scenarios to predict how the next years might look. This was published in a Nature journal, and it's speculate about a situation in June 2021. It goes on to say the world has been in pandemic mode for a year and a half. The virus continues to spread at a slow burn. Intermittent lockdowns are the new normal. An approved vaccine offers 6 months of protection, but international deal making has slowed its distribution. An estimated 250 million people have been infected worldwide, and 1.75 million are dead. So scenarios such as these were developed, and the right-hand photo shows a cinema in China. There are people maintaining distance. But when I read this article, I just laughed at this article. How can this be true? This was in August 2020, when we thought we are under well control on this epidemic. However, the total number of cases in the world were rising. As of end of June, there were reported 182 million cases, little less than the predicted number in the article. However, when it comes to deaths, there were about 200,000 deaths, which is more than the number predicted in the article. Sorry, 3 million deaths. As of today, there are a total of 228 million reported cases and 4.6 million deaths across the world. When you look at the figures or the cases across the world, these how the cases were going up and down, and these how the deaths are going up and down. So we can see it's coming in waves. So we are probably in the third wave, or some people say it's the fourth wave, whatever it is. The question is whether this is going to, once this goes down, whether we are going to get another wave. If you consider the situation in Sri Lanka, this is how the deaths increases from 1st of April. From 1st of April, you see the total number, the deaths went up to more than 200 for several days, and now fortunately seems to be coming down. And the number of deaths are high, even in the estimates of at the early stage of the illness. The estimated figure was around 3 to 4% worldwide, especially in China initially. But the worrying thing was the death rate among patients who were admitted to hospitals were quite high. The initial estimates show that it's about 15%. And this is compatible with what we see from various, the evidence we get from trials also. This is one of the trials, the famous trial among medical people, a solidarity trial conducted by the WHO, where the death rate was around 12%. And this is another trial done on this, one of the famous drugs, remdesivir, which is of not much use though. Again, a death rate ranging from 7 to 12% was noticed in the US. And then this another famous trial among medical people, the recovery trial, which was done in the US, where the death rate was around 20, ranging from 22 to 25%. So quite a significant proportion of people who got admitted died of this. Still, they died. So these excess deaths were reported, highlighted in many forums. This one of some such article, and this how it went up during the in the early part of this year and the last year. The number of deaths in the UK. On 3rd of January, they had 75,000 deaths. So in many countries, thousands are getting infected, thousands are dying, hospitals are overflowing, necessary protective equipment are running out of stock, doctors, nurses, and other health staff are getting infected. And now to add to those, we see other effects of so-called post-COVID syndromes. Then we see in media a lot of reports on about young people getting affected, getting complications. And this affects our psychology. This is an article in the BBC published more than a year ago, which is true for today as well. It goes on to say the topic is the threat of contagion can twist our psychological response to ordinary reactions, leading us to behave in unexpected ways. It goes on to say, rarely has the threat of disease occupied so much of our thinking. For weeks, almost every newspaper had stories about the coronavirus pandemic on its front page. Radio and TV programs had back-to-back coverage on the latest death tolls. And depending on who you follow, social media platforms are filled with frightening statistics, practical advices, or gallows of humors. It's still true. And the article continues saying this constant bombardment can result in heightened anxiety with immediate effects on our mental health. But the constant feeling of threat may have other more insidious effects on our psychology. Due to some deeply evolved response to disease, fears of contagion led us to become more conformist and tribalistic and less accepting of eccentricity. Our moral judgments become harsher and our social attitudes more conservative. I believe, even though this was written more than 15 months ago, still this is true. So with all this, there are many problems. There were discrimination of patients, as you all know, by the society and at health facilities, the criminalization of COVID patients. Then there are other effects, like closing down of factories, offices, schools, movement restriction, as we have one now, economic recession worldwide. And then there are other effects like more use of internet, etc. If you look at what happened in Sri Lanka, I believe before talking about the future, I think it is good to talk about the past. The first patient was reported on 26th of January, the famous Chinese lady. And then we had the first local patient on 10th of March. And up to early part of August, we had a little more than around 3,000 cases with 11 deaths. So we thought we are doing reasonably well. And we had the quarantine processes initially for some countries, but then the airport was shut down on 19th of March for passengers. Then there is direct involvement of His Excellency the President on the controlling activities of COVID. There was a task force headed by the Director General of Health Services and the Command of Army. Then there were committees headed by key politicians. There were several committees in the Ministry of Health. Then the quarantine facilities are handled by Sri Lankan Army. Then there was decision to lockdown, closure of airport, involvement of armed forces and police for contact tracing. And then there was gradual reopening once the cases went down. So we had during the initial days, this was last year, we had a few outbreaks. And this is from Kandakadu, the Navy garrison, and then the Kandakadu. And then things were pretty good. And for 2 months, we did not have cases from the community. Then we forgot we have to live with COVID. and we relaxed. You can see many of these, not only the general public, even the leaders relax. You can see many of them are not wearing masks. Even those who are not wearing masks are not wearing those that correctly. So the relaxation was so much. And then we started seeing the effect of this by October. And this effect continued. And by February, early February, we had 800 odd cases. And now, this is the present situation. And it's important to look at this, compare the initial period with this. This sort of what we see as fairly large number of cases is actually, it's here. In the period of, it's here actually, the period of December. And you can, you can see the rise of the number of cases. These are actually the reported cases. This overlap of case numbers and deaths. The right side has the death numbers. These are the left side has the case numbers. And if we extrapolate this, these are the stringent index. This is a world accepted index prepared by the Oxford University, where they consider various things in the restrictions in a country. This they prepare for. You can get it from any country. And so we have quite a strict index here. That was in April, early part of April up to June last year. And then we had again, this was in February, March, and then we suddenly relaxed at early April. And then again, we had to increase the restrictions. Again, we relaxed suddenly by early August. And if you overlap this with the case numbers, you can see how nicely it correlates. You can see initially with the very strict stringent measures, the case numbers were very low. And then when it relaxed, it started to go up. And this was in April. When it came down, by end of April, we saw this large rise of case numbers. And then again, we saw another large rise of, in spite of when these measures are relaxed, again, the case numbers started increasing. These up to 12th of August. If you continue this, you see it goes into a dump and came down because of the stringent measures again applied here. However, you can see, you can appreciate here, the stringent measures were applied much later than it should have been. If these are applied here, probably we would have been open by now. We had to be closed still because these measures were adopted, the restrictions were adopted much later than it should have been. Then another worrying thing, contributory reason for this rapid spread is the spread of the Delta variant. This is from Professor Nidika's lab, which showed these blue bars are for the Delta variant and the small green part is for the Alpha variant. You can see still in some parts of the country, there's a little bit of Alpha variant remaining, but otherwise in most, almost all the parts are filled only with the Delta variant, which has the ability to spread very rapidly. And that is one of the other main reason for to see this much of large numbers in the country. And in parallel, we see this vaccination program which had been going on. This is as of today, this morning. This is from the website of the President's Office, which is the website designed by the State Intelligence Service, and data collaboration is from Research and Analysis Wing, State Intelligence Service, and the Epidemiology Unit, Ministry of Health, which says the first, out of the eligible population, which we considered as people above 20 years of age, about 92% had been given the first dose of vaccination. And out of this eligible population, about 73% had been given the second dose of vaccination, which is quite a good rate. And once we complete this also, probably we'll be at a better state. However, when you look at countries where vaccination program has gone on well, these from Israel, the figures from Israel, you can see in spite of having very good vaccination program, still they have got an outbreak here. Actually, this outbreak is larger than their previous outbreak. But the good thing is, even though the case numbers are going up, these are their deaths. You can see that number of deaths are also going up. But compared to the previous time, the number of deaths are much less. This is less than maybe about 60, 70 per day, the highest, whereas they had more than 100 per day with the early outbreak. So the effect of vaccination is shown there. Even though the number of cases can go up, the number of deaths will be reduced with vaccination, good vaccination coverage. However, the two companies which produce two mRNA vaccines, the Pfizer and Moderna, says the COVID vaccine protection wanes over time. So we have problems, and they say protection from their COVID-19 vaccine can wane over time as the US drug regulator prepares to consider whether to approve a booster program. Ahead of a crucial meeting of the FDA Vaccine Advisory Committee on Friday to discuss its booster proposal, Pfizer on Wednesday submitted a study showed that the vaccine efficacy wanes over time, irrespective of the variant, rather than as a consequence of Delta corona strain evading its jab. So still, it's not due to the variant. The variants are not evading the vaccine. They haven't developed to that level yet, but still the immunity tend to wane off. So are we to get a booster dose? This is an article published just 5 days ago in the Lancet journal, which is one of the key journals in medicine. It says any decision to do so, that is the booster, should be evidence-based and consider the benefits and risks for individual and society. COVID-19 vaccines continue to be effective against severe disease, including that caused by the Delta variant. So it has to be discussed and decided whether a booster is necessary or not. Now, maybe later, yes, but when to give it is again a question. So with this setting, what can be the future? I could thought of 3 possible scenarios for the future. Scenario 1 is the virus disappeared from the world. Looks very hypothetical, but this has happened before, especially if you think of the SARS outbreak, which occurred in 2002 and 3. Suddenly the virus disappeared from the world. It was a viral disease with a very high mortality rate, much higher than COVID. However, the infectivity was not so much. And then after several months, the virus disappeared from the world. So I hope that would happen, but probably unlikely. On the other hand, the virus can develop as you all know, the virus forms many variants. The virus has more variants, which can be resistant to the vaccine. And then it can spread rapidly, causing more outbreaks and more deaths. That is another possibility. On the other hand, the vaccine efficacy wanes off gradually, necessitating booster doses. Virus causes outbreaks from time to time, but because of the vaccination program, deaths are less. So I like to believe the third scenario as the likely thing we are going to see in the near future over the next few years. I hope to believe that. Of course, if we get the scenario 1, that's very, very much better, but then this is less likely. So the more likely thing is probably the scenario 3. So in this situation, what can you do? Where we have to live with COVID. So once again, since we have to live with this, we have to minimize the spread. The basic precautionary measures are important. Hand washing, practicing cough etiquettes, social distancing, especially avoiding unnecessary gatherings, maintain distance, they minimize touching surfaces unnecessarily, good balanced diet, not vitamin supplements, of course, those are not necessary, regular exercises, good ventilation, good sunlight, avoid smoking, the face mask, of course, wearing properly. So we have to avoid things like this and things like this, and probably we have to adopt to our traditional things like this, which are not only unique to Sri Lanka, but we see in other Asian countries also. So it is high time to think of such changes in our habit. And what else we can do? We have to live with this in the future, at least for the next couple of years. So how can we respond to this crisis? There's another side of story, I believe. What we see, or what many see, is the gloomy side of the story, where it spreads rapidly, a lot of people get infected, a lot of people die, and the hospitals are overflowing, the hospital staff getting helpless, becoming helpless, and then countries are locked down, the normal day-to-day life is disrupted. So this is one side of the story, but is that all? It all depends on how you look at this. Winston Churchill has supposed to have said, never waste a crisis. And it depends on how you look at a crisis. You can have a negative viewpoint of this, or maybe you have another viewpoint. There can be positive reasons. So what can we, are there any positive things? If you look at how we handle crisis situations in our history, I think probably the World War II was the biggest one, which we don't have experience. And then the JVP insurgencies, the 1971 and 87-8, then the separatist wars, tsunami, then of course the COVID-19. I believe we handle